Hi, thanks for joining us. I'm Megan.
I'm Karina.
And we are with Elta MD, and we are here to answer your big questions regarding sunscreen. And we did get a list of questions that you all in Colorado Springs have asked. So, Karina, why don't you give it to us?
Okay. First of all, the biggest question is what makes a good sunscreen?
So, when looking at a sunscreen, you always want to make sure that you're wearing an SPF 30 or higher. And the reason being is SPF actually pertains to UVB rays. And to simplify that, think UVB, B for burning, your sunburn rays. You also really want to be wearing a zinc sunscreen. The problem is, in the past, zinc was this nasty white paste that no one wanted to wear. So as technology has changed and the medical grade sunscreens, for example, what you can buy at the shop, they are going to be zinc based, and they've taken the zinc and made them molecular size small enough that when you put it on, you don't look like Casper the Friendly Ghost. And with Elta MD, anybody that is working over in the shop or the laser center can always help you get the best sunscreen for you. So there are many different options using that small transparent zinc in different basically formulations to fit your needs, whether you're acne prone, whether you want something that has a tint, or if you're looking for, hey, I need a really good body sunscreen for my family and we're going to be in a water type environment.
The biggest thing is a lot of people ask, when should I wear my sunscreen?
Every day, people. Every day. And the reason, I will joke with you, is your skin is your largest organ. Our teeth. Your dentist doesn't tell you brush your teeth when you feel like it. Why? Because you want to have, as you age gracefully, a full mouth of teeth. So you brush your teeth every single day. Same goes for your skin and your sunscreen. Every single day. Again, you want to get a sunscreen that fits your skin type and fits your needs, so you want to wear it. Nothing's worse when someone says, here, buy this, and then you get it home and you're like, I hate this. I'm never going to wear it. The beauty is there are many different formulations out there to truly fit what you need and what you like to wear.
And they come in tinted and non-tinted as well. So if you want something that absolutely has no tint to it, great. If you want something that has a little bit of tint, we have that here for you as well. So it fits all skin types, whether you're, skin type 1 or all the way up to darker skin types. The other question that we get is, how much sunscreen should you use?
You can answer this one.
So this is a funny one, but the amount of sunscreen that one should be using from head to toe is actually a shot glass full. So a lot of times people aren't putting on enough sunscreen either. So just a little dab and they rub it in and they think they're protected. But you want to make sure that you're covering your entire face. So what I suggest is putting one layer on and actually doubling it. So putting on one more layer, just in case you've missed a spot, you're bound to hit it with the second layer of sunscreen.
We've also gotten asked, okay, great, sunscreen, but what are all of these other products and what can I do for anti-aging? Sunscreen. It is the number one thing you can do for anti-aging.
It keeps you out of the derm office, getting things cut off your skin and, dealing with skin cancer. So it is honestly the number one anti-ager because it protects you. And anything that you do aesthetically, whether it be your fillers or your lasers, it protects your investment. So it's basically like insurance for your skin, which is really, really nice. There is a question about the difference between physical and chemical, what the difference is in that.
And we'll try to keep this short and sweet, but basically a chemical sunscreen is anything that you're going to buy in your drugstore. If you look at the back of your Coppertone, your Banana Boat, most of your Neutrogenas, you turn it over, it's going to have a list of different chemical sunscreen ingredients. And how a chemical sunscreen ingredient works is you put it on your skin. And your skin has to absorb those chemicals. We go out into the sun. The sun rays actually activate those chemicals. And so there's a chemical reaction happening in your skin with those chemical sunscreen ingredients, and they're actually neutralizing, UV rays. A physical sunscreen, which zinc, titanium, they're physical ingredients, they're minerals, You put them on your skin, you go outside, sun rays come down and they reflect off. Think about it like you went outside and you opened a very opaque umbrella. None of those sun rays are getting onto your skin. So there is a difference. Chemical sunscreens, your skin has to absorb the chemicals. Those chemicals actually neutralize the sun, UV radiation, whereas a physical sunscreen, which is zinc titanium, a mineral, you put it on your skin, sun rays come down, they deflect off. We also know with a physical sunscreen, if you are looking at how much protection you're getting from your burning rays and then UVA, your aging rays, we know wearing a transparent zinc sunscreen is always going to provide you the longest continuum of protection compared to an over-the-counter sunscreen that consists of chemicals that kind of gives you little spots of protection. When if you're getting this much sun, think about it, little spots, whereas if you're getting this much sun, zinc is going to cover a much longer continuum or portion of those sun rays.
Yeah, and there's only so many times that chemical reaction can happen before the chemical stops working, and unfortunately, we're not good at reapplication. So that's why a physical is really, really important, because essentially it's there until you remove it. So I like that for the longevity of the formula as well.
So go visit the shop. They are very good. We, of course, would love if you purchased an Elta MD sunscreen, but Krista will get to the right sunscreen for your needs. Thank you.
Thank you, guys.